According to a 2023 BBC study in 6 African countries, a woman in Ghana earning a minimum wage of $26 a month would have to spend $3, or 1 in every $7 they make, to buy 2 packets of sanitary towels. That means for every 80 cedis they earn, they have to spend 11 cedis on pads alone. A latest study by Sen Ghana also reveals 70% of young ladies in the country are unable to afford pads because they are expensive, forcing them to exchange money for them. Patricia Akwa is a student activist and member of Sen Ghana's research team.
The findings that blew my mind was where girls have to exchange, go in to have sex with their male counterparts for them to get money to buy this sanitary products, because I never knew this was really happening in some communities till we got to the grounds and then realized that, oh, so this is really happening in some communities where other people can easily afford, not everyone, but then other people have to put their lives at risk by having sex, where they are exposed to a whole lot of risks like STIs and then UTIs. But then because they have to use the pad, they have no option than go in for the sex and then get the money.
Pads to be scrapped and for the products to be reclassified from a luxury product to essential medical need. Also, that government in collaboration with GES should intervene by providing sanitary pads in schools.
Our recommendations are very simple and straightforward. If disposable sanitary pads are expensive and it is caused by taxes imposed on them, scrap off the taxes. Because when you do that, it will help reduce the prices for them. And
welcome back to the conversations on the AM show. Now let's talk about this crucial subject about girls who have to trade sex to buy sanitary pads. Now, about 1.8 billion people across the country, the world, that is women, menstruate each month. But there's been some challenges, particularly here in Ghana. Some of these girls, thousands of these girls, face challenges affording sanitary pads, mostly in the southern, northern, and coastal areas of Ghana, as we have seen in that report that was just showed to you. But let's get into the conversation and understand what the gaps are in our approach to dealing with this issue and what we can do about it. I've been joined in the studio by Madam Anna Nabere, who is project manager of She Leads under the Plan Ghana International, and Mr. Holali Delechu, the alumni president and the convener of the petition that was presented to the government in 2020 to remove taxes on sanitary pads. Later on in the conversation, I'll also be joined by Dr. Otiko Efisa Jaba, the executive director and founder of Henry Jaba Memorial Foundation, and the former Minister of Gender, Children and Social Protection. Look, let's get into the conversation. Ladies and gentlemen, welcome to the studio.
Thank you.
Thank you very much.
First of all, you are the forefront of, leading the charge of either reduction of cost of sanitary pads or scrapping taxes completely, or even ensuring that women and girls across the country understand what menstrual hygiene is. Tomorrow we mark another menstrual hygiene day celebrated. This will be the 10th anniversary. I cannot say that we've not reached some milestone. I mean, even here in Ghana last year in November, we saw in the Kunimdie budget that the taxes on locally manufactured sanitary pads have been scrapped. So there are some things that are happening that are good, but there are still some challenges. So let's start by asking, what are some of the significant milestones that we've achieved before we get into the gaps that is causing these challenges? I'll start with you, Holali.
Thank you very much. Just like you mentioned, in the budget that was read last year, the finance minister mentioned that the government was going to take care of that particular, covering of the taxes on locally produced sanitary products, which is the biggest milestone we've covered so far since this conversation, began in 2017. And, for us as NGOs or, social advocates, we believe that a lot more could have been done. But if the government has taken this step further, it's a plus. And also the education has gone wide. I'm sure you'll be asking why a gentleman like myself is part of this conversation. It's all because we have come to realize that our society needs everybody on board. And so you find more and more men like myself now part of the conversation and pushing for a change.
Okay.
Yeah.
Holali, how do you feel about all of this, about girls having to trade sex for sanitary pads? What are your initial thoughts?
You said
Anna, sorry. My bad, yeah.
Yeah, it's a serious issue. It's not just about the research that I have listened to here, but it is something that I know.
Okay.
Through the work that we've been doing and through one of our local implementing partners, they did some interview with some rural girls, and it came out that they do it. They sell themselves. They exchange sex for sanitary pads. And why are they doing all these things? Because they cannot afford. Sanitary pads are so expensive. Some of them, even how to get the required meal for the day is quite challenging. So for them to have money to buy sanitary pad is something that most girls in rural areas do not have, especially girls with disabilities. And they are the most vulnerable, and they find themselves in situations like this. So what is happening is the reality. What we are saying and what the research report is saying is real, is true. It's happening.
Let me bring in the former Minister for Gender and Children and Social Protection into the conversation. Dr. Tiko Jaba, thanks for joining the conversation. Now, from where you sit as a former Minister of Gender, Children and Social Protection, and this issue that is coming up, I believe it's not just coming up. There's been lots of years dedicated to this, and tomorrow we celebrate 10 years anniversary of marking International Menstrual Hygiene Day. What is your reading on this situation as pertaining to girls having to trade sex for sanitary pads?
Thank you very much. And I would like to say good morning to your viewers and my co-panelists. It's a very deplorable situation, not just as a former minister, but as a woman, and also as a mother of 2 daughters. I find it unacceptable that to date, after so many years of independence and having women at the forefront of discussions, celebrating not only the International Women's Day, but the Girl Child's Day. We are still here talking about girls selling themselves for sanitary towels. It's unacceptable, totally unacceptable for a beautiful country like Ghana. So I condemn it. And I feel strongly that parents must sit up. We have responsibilities to our children, and we need to help them to understand their femininity and how menstruation and the hygiene and all the things that go with it, and also to support them to buy the towels and what have you.
Right.
Apart from that, you can also have the schools educating the children. And of course, government coming in to ensure that they remove the taxes, especially for people who produce them in Ghana, the sanitary towels. When we talk about one district, one factory, why can't we even have one sanitary towel production company in maybe the northern zone, the southern sector, and the middle belt? It's possible. I don't know why we are taking so long about these things. It looks like anything that has to do with women, we tend to relegate it to the background. But we are saying that we have had enough, and this issue must be addressed now. Not next year, but this year. Even in celebration of tomorrow's day, the government can come out from the magnanimity of their hearts and tell the people of Ghana that, look, our girls are so important to us that we are waiving the taxes and we are going to begin these factories in Ghana.
Okay.
And that will be a step in the right direction.
Okay. Dr. Tiko, I'm curious, did any of these issues come up during your time as a gender minister? And why do you think the areas that we are experiencing these things are the coastal, northern, southern areas? What do you think explains the reason for this, and what specifically are we missing? First, did these issues come up in your time, and what are we missing?
Thank you. When I was a minister, I went around the country, and in the northern region, when I met the chiefs, they were very, very, very particular about child prostitution amongst the girl children. It was not just to do with menstrual hygiene, but to do with prostitution in general for children as young as 10, 12, who were becoming breadwinners from prostitution. And we decided that we would bring it to the forefront of discussions.
It appears we lost Dr. Otiku, but let me bring in now Madam Richlove Amamu, who is the Central Regional Director for Gender. Madam Richard, thanks for joining the conversation. I was just, the former Minister of Gender was just responding to why these issues are concentrated in the southern, northern, and coastal areas. And you are a Regional Director for Gender in the Central Region. Why do you think that the Central Region is experiencing such issues of girls trading sex for sanitary pads? Do we have Madam Richlove online? All right, there's a problem with the sound, but Dr. Otiku, are you still with me?
Yes, I am.
Right, please finish your
still
trail of
here.
thoughts. Yeah, we lost you for a second.
Yes. I was saying that the chiefs brought it to my attention that there was child prostitution among girls in the northern, the upper, and the eastern region due to poverty. So the children were now selling themselves to be breadwinners so that they can feed their families. And that is to do with poverty.
Right.
And lack of understanding of the importance of education and understanding the responsibility of parenting. No child should be a parent. Why should a 10-year-old be a breadwinner? And because of that, the girls were becoming very rude because they were now looking after the parents.
Right.
And the girl goes out and comes home very late, and the parent is not able to admonish the child because the child is now paying the rent and the electricity bill and what have you. It happens in the Central Region as well because that is where there is a lot of poverty. If you look at Ghana, it's the Upper East, Upper West, Northern Region, and the Central Region that are most deprived. And we have the highest data of poverty in those areas.
Right.
So poverty plays a key role to prostitution. Adults are engaged in it for the same reasons. When the job money is not balancing, you can't pay school fees and all sorts of things are happening that require money. Women and girls feel that the first place of call, the easiest, is to go into prostitution, which is unacceptable because of the ills that come with it. You might get sexually transmitted diseases. You might get unwanted pregnancy. You might get raped. The violence that comes from prostitution is totally unacceptable. And we are all aware of all these things that happen. But an older person is more aware than a child who feels that, look, I have no choice. Some parents even push their children into prostitution because they feel that that is the only way to make ends meet, like pushing your child to go and sell donuts on the streets or dog chains and what have you.
Okay.
But
thank you, Dr.
I want to say this before we move on, that even if you are poor, you have a sense of pride. Poverty doesn't mean that you should shirk your responsibilities and not have a sense of value and love for your child. Hunger must give us a certain sense of responsibility, that it is the adults and the parents who must provide for the children and not for a child to go into extremes like child prostitution.
Right, thank you so much. Now let me bring back Madam Richlove Amamu, who is the Regional Director for Gender in the Central Region. Madam Richlove, so Dr. Otiku was just saying that poverty is the #1 reason why these girls are trading sex for sanitary pads. But from where you sit, what specific policies or legislative actions are needed to create this period-friendly environment for girls, particularly in the southern and coastal areas who are, facing these challenges? Madam Richlove, please unmute. If you can hear me, please unmute. Okay, great.
Yes. Can you hear me?
Yes, go ahead.
Thank you very much for the opportunity. I want to direct my submission to the Central Region, precisely.
Okay.
And I heard my sister talking about a Central Region being one of the poorest regions in Ghana. We are no more the poorest anyway. So that is another issue.
Right.
But with the Central Region, when she's talking about poverty, yes, some parents use that as an excuse to share their responsibilities as parents. But what we are doing, the Department of Gender, under the Ministry of Gender, Children and Social Protection, is the implementing arm for the sector ministry of the Ministry of Gender, Children and Social Protection. And we are the people who takes care of the gender component of the sector ministry and work under the Regional Coordinating Council as well.
Right.
So we implement programs and projects at the regional level. So when it comes to poverty, yes, we know it is something that everyone talks about, and everybody doing something that is not good, used as an excuse. But in the central region, what we are doing, I'm sure the conversation is related to Menstrual Hygiene Day, right?
Yes.
Good. So what we are doing is to create awareness.
Madam Amu, how are you doing this? You also mentioned that you've been implementing some projects and programs. What are some of these programs and projects, and what specifically are you doing to curb this situation or to nip it in the bud?
Thank you very much. We work with the legal framework, and we use the Children's Act 560/1998 to educate parents of their responsibilities. So at the regional level, at the community level, we have clubs for parents. And those clubs, we educate parents, we sensitize them on their responsibilities. And then we also have clubs for the adolescent girls as well. So sometimes we meet both the parents and the girls. And the girls are girls that we have trained, so they speak out. And they told us the challenges they are having with their parents not providing them with their needs. So we've realized when it is time for their menses, it's difficult for them to get sanitary pads to use. And that is the problem. It is true some children came out to say that because of that, they have to enter into a relationship so that at least at the end of the month, they can get something to buy sanitary pad. So
right.
So throughout our activities, when we meet the adolescent girls, we give them sanitary pads and also educate them on the traditional method. In fact, if we are not in the community to give them the sanitary pad, one, we speak to the parents to do that. And if the parents can't afford, genuinely, some parents can't afford, fine, what we do is we also take them through the traditional method, how to use it without any challenge. So in 2022, Menstrual Hygiene Day, the Central Regional Minister, Honorable Mrs. Justina Marigold Essen, partnered the Department of Gender, and she gave out 7,000 sanitary pads. She shared it, and we went around the district. We visited about 4 districts.
All right.
And yes, in 2023, she did the same thing, but unfortunately, I lost my daughter, so I couldn't join the campaign.
So, Madam Richlove, my question to you is, I guess I'm asking is, do you think what you're doing is enough? Because the problem persists. You're listing all these nice programs and projects and these regional initiatives, coaching parents and all that. Do you think that's enough? Or do you think it's working? Because according to the data, Central Region tops the number of the areas that we are finding these issues of girls trading sex for sanitary pads. If it's not enough, what can we do going forward? And please keep it short for me. We're racing against time.
Yes, okay. But my sister, the other funny thing is, the NGOs comes to the region, collect data, without even sharing it with the government machinery working in the region. We don't even know what they come here to do. So you have this data, you should have worked through the ministry, the Department of Gender, Do you understand? So that RCC know what you are doing in the region. Now you collected the data is out. But as we are here, RCC doesn't know what they came to do in the region. That is why we said we can't do it alone. On the 15th May, we brought all the NGOs operating in the region together. We met them at the banquet hall. And we want to strengthen collaboration with them so that we can join hands together and try to control the situation. So when you come to the region to do that, we must be aware of what you are doing so that we can also support. We do with them.
Points made.
The other thing I want to, my sister, the other thing I want to add to it, you asked if it is working. The only way this thing can work is to let parents know the position of the law when it comes to parental responsibility, that it's a criminal offense if you don't take care of your children. And then if parents start being responsible, I think we can also control the situation.
All right. Thank you so much, Madam Richlava Mamu, the Central Regional Director for Gender, for joining the conversation. Now, let me come back to the studio. Anna, I'll give you time to respond to some of the because I saw you smiling and shaking your head. Time to respond to this. But I know Plan Ghana had been leading the charge in 2022 or so for reusable sanitary pads. So going forward, do you think that that's a solution? Because it's becoming popular. Anna, what are your thoughts?
Yeah, thank you very much for the question. To some extent, we can consider it as a solution to the problem. But if we look at the challenges that are associated with reusable sanitary pads, the question we should ask ourselves, is that the best that we can do for our girls and women? And surely I think the answer is no, because a lot of challenges are associated with it when it is not properly managed. You know, it involves washing, and if in some areas they do not even have the water that is needed for them to wash and keep these materials hygienic. So for me, I think it's not the best. But what I would say is any intervention or any initiative that we take, we should look at the sustainability. We should look at the future. We should have the future in mind. For example, if girls in schools do not have places to change, what are we supposed to do? Going to schools and distributing sanitary pads is good. But to me, it's temporary. But if we can move to another step by looking at how can we make these sanitary pads affordable and available always, so that we don't have to go around begging people to contribute sanitary pads, so that we carry them to schools to distribute for 1 month, 2 months, and the girls, they go back to their original state. So for me, I would recommend that whatever we can do, government, NGOs, and all those people that are concerned, to make sanitary pads affordable and accessible. In addition to that, when girls are in their menses and they are in school, they are in public places, they face a lot of challenges. What Plan International Ghana is doing currently is to go into about 18 public schools to provide them with hygienic and facilities that they can manage their menstrual hygiene properly. And in each of these schools, they have provided facilities, and then the facility consists of 2 toilets for boys, 2 toilets for girls, 1 toilet for teachers, and all that, including changing rooms. So that when they are in school and there's a need for them to change, they can move into such a place, do their thing dignifiedly, and then come out and continue with their learning. In addition to that, they've even provided facility to ensure the proper disposal. You know, when we are talking about the disposable sanitary pad, we have to be looking at the environmental challenges and risks. And Plan Ghana, we are taking steps to ensure that any facility that we provide, that will ensure the proper management with of the menstrual cycle or menstruation goes with environmental management practices. Thank you.
Right, and I like that you said dignity, because this is not just about an equality issue, it's just about human dignity.
Exactly.
But I mean, although this survey that's brought up all of this, it's not from Plan Ghana, it's from Send Ghana.
Yeah.
You're also an NGO. I would like you to respond to that assertion that the regional director made concerning NGOs coming into the various communities to conduct surveys, but not sharing the details of the report with them so that they can see if they can fix the situation at the, the grassroots, rather than making the issue public and then it becomes a whole issue that is just news and nothing is really happening about it. What are your thoughts on that?
So for me, what she's saying, I cannot say what she has said is not true or is true. But what I know concerning Plan International, we cannot go into a community or a district to conduct a research, to conduct a program like this without involving the government agencies. So if there are NGOs that are doing that, we should condemn it. We should say that they are not following the right processes and it will not be helpful to the nation. Because like she said, we need a collaboration. We need to work together. So if they have the money to go into the region or the district to do research, they should work with the government agencies. After all, NGO comes and go, but the government agencies will continue to be there to work. So if there is any information, that information should be made open or known to the government agencies so that they can pick it up and implement. NGOs are not the people who are supposed to provide everything. It's a collaboration and we can support. But the duty bearer, the government, the district assembly, they are the duty bearers, and they are the one we should hold responsible. So if there is any way we can support them to have the information and provide what is needed, it's very important. So to some extent, I agree with her that if there are NGOs that are doing that, we should condemn it.
Okay, I'm coming to you, Holali, for my final question. Tomorrow is, set aside to celebrate Menstrual Hygiene Day, to, shed lights, create awareness, correct misconceptions, myths, and all that. So my question to you is, what role where do boys and men come in the fight for dignity when it comes to menstrual hygiene? Okay,
so quickly, before I respond to this, the question you asked the Central Regional Director, few of the things that can be done, which the government has already started doing, is the tax reliefs, and then probably the distribution programs that is being implemented in Kenya, Botswana, South Africa, and Uganda. If Ghana can take that up, like my big sister said, is this sustainable?
It's about availability and affordability.
This morning, before I came here, I passed by the pharmacy just to check the price, and I got one. And a sanitary, the least you would get on the market is 10 Ghana cedis. That's the least. A lot of these young girls, when we go on the field, can't afford 10 Ghana cedis. And talking about family responsibility, most of the parents do not even have it. The economic empowerment is very little. And so where would they get it from before they will be able to afford this? Now, coming to what boys and men can do. Like I said, the narrative
has changed. Because they're sleeping with you. I mean, the girls are sleeping with boys.
That's a general statement.
You know what I mean.
Yes, I know what you mean. So what can boys and girls do? Like I said, we've been a voice championing the cause for equity for a very long time. And so I can only say that we can join hands more and more, especially people in places of authority. I was so glad when I saw one of the parliamentarians during the budget reading standing up and to add his voice to this particular, proposed policy. And I was really excited because it's been long overdue. We don't really get men doing that. So for boys in schools, interestingly, we're in a school in Pung or somewhere, and the teachers were shy to address menstrual hygiene concerns. Even female teachers, they left their classroom when we were doing this because they didn't have that conversation. They couldn't have those conversations with their girls. And so for men and boys, I think, starting from here and everywhere else, we should be able to stand up and say that, look, this is not something to shy away from. It is just blood that is coming out because it's not been used. And so we can't say that we are shying away from them. And let's continue to engage the government and propose for changes that will help. Like we said, this particular menstrual hygiene period is a free, period-friendly world for girls. And so we should be able to create a period-friendly world for girls as men and boys.
I want to go back to Dr. Tiko, but you have something.
Yes, I just want to add something quickly. You see, menstruation is seen as girls and men, women
and girls
issue. So they should be concerned about it and they should be talking about it. So if we are able to get boys and men into the whole show, it will bring another perspective. It will help people to appreciate that it's not just for women, but it benefits the entire society. So bringing in men and boys as champions of change or allies will help to diminify some of the myths and misconceptions that are around menstruation.
Okay, let me come back to you, Dr. Tiko. What's your position on the advocacy to remove taxes on sanitary pads or to just distribute them freely to girls in marginalized communities? And then you can add your final thoughts to
Hello, can you hear me?
Yes, I can hear you. Did you hear my question?
Hello, can you hear me?
I can hear you, Dr. Tiko. Please go ahead.
Hello, the line is breaking. Can you hear me?
I can hear you loud and clear. Can you hear me?
I didn't hear what you said.
Right. I was asking, what's your position on the advocacy to remove taxes on sanitary pads or to just distribute them freely to girls in marginalized communities? And then you can add your final words.
Thank you. I don't agree with distribution of sanitary pads because it's not sustainable. We cannot keep giving it out for free. No government can do it, especially with the current situation we are in under the IMF and all of that. So what I am proposing is that, yes, the taxes should be removed, especially for producers in Ghana, and to support them to have the machines, to establish factories to start with in the various sectors, and then we can have it in the regions. And then we can put the girls or their parents on the leap. If you have a certain criteria of scoring and ranking, you'll be able to tell those who most need some things like that. So that if people can afford, those who can afford will not be given, like the child benefit allowance that is given to some parents outside the country. We can decide that we can give every child, especially every girl child, a certain allowance, either on the leave or on some government scheme, so that they don't need to sleep with anybody to be able to buy sanitary towels.
Right.
The other thing that we can also do is to ensure that with the education of the men, that, look, a girl can be your sister, they can be your child. And so instead of sleeping with them, for them to be able to get money to buy these essentials, give it to them and not sleep with them. Why can't men do that? Because that girl could be your child, and that girl could be somebody's wife one day. That girl could be a contributor to the development of Ghana. Okay. And if she gets involved in sex, she might get unwanted pregnancy or a sexually transmitted disease, which would curtail her dreams. And then parents must understand that no child has ever asked to be born. And so if you have a girl child, it's your responsibility to educate her about these things and how to take care of herself. There's nothing shy about sex. After all, you had sex to have the child. So why are you feeling shy to talk to the child about menstruation? It is something that is about all of us, because it is the woman that gives birth, and without menstruation, you can't give birth. There's nothing dirty about it. As Hannah talked about the dignity, it actually reminds us that you have become a woman, and this is your time to start preparing for motherhood.
Thank you so much.
So it's incumbent on the government to also make sure that the schooling, the teachers, the parents, all of us are involved, and to ensure that the girl child is the most important factor in this equation, because she becomes tomorrow's woman and tomorrow's leader. And if she's missing classes or getting involved in sex at this early age, then it means that we are losing out. And it is an indictment on the government and all of us.
Thank you so much, Dr. Otiko Jaba. I see how passionate you are about this. We do have to go, but Mohammed Tajuddin Abdullahi, the programs officer at Send Ghana, just joined us, and I want to let him bring us home. I mean, your outfit, Mohammed, conducted this research that has opened up this conversation. How does all of this sit with you? And going forward, what do you think we should do to ensure that these girls are safe?
Thank you very much. Good morning to you, and then good morning to panel discussants as well as your cherished viewers. I think that Basically, what we are looking at is the fact that our girls in the communities are struggling to access safe menstrual pads to be able to menstruate freely and in dignity in a safe environment. We know that, for example, the research that has been conducted by us has established that a lot of young people are really actually struggling. And in some cases, people are even beginning to struggle between making a decision to use their linear income on food or on pub, just because there are a lot of taxes imposed on these materials that we find that very important for the dignity of the girls and women. So all we are asked government to do is to consider scrapping the tax, because we know that the taxes that are actually making the product very expensive. Our research is saying that about 70% of the people that we reach cannot actually afford to buy sanitary pads. And in those cases, they are compelled under the circumstances to use unhygienic materials to be able to absorb menstrual blood. Some are exposed to infections, others are exposed to sexual exploitation. So we are actually calling on the government to consider scrapping of the tax and making sure that is made more accessible to girls, especially those living in poor households.
All right, Mohammed, just give me some clarity here. You were out there on the field interacting with some of these women and girls, and this is largely an economic issue because they cannot afford to buy sanitary pads. Is it that they cannot afford to buy sanitary pads, so they're only having sex with these men to buy only sanitary pads, or just for other basic things?
Well, I think it's a combination of factors. We do know that we are particularly in a situation where everybody is struggling to even cope with the current economic crisis. But things like sanitary pads are essential products that girls and women cannot do without. So you see, it is not just because people are just interested in having illicit sex with men, but because they are in that situation. They have found themselves in that situation that they need it. It is something that they need. And whatever it will take them to get it, it is what they are actually doing.
Right.
And we are saying that as a country that we are priding ourselves as people that are interested in empowering women and girls, we need to look at this issue very
All
critically.
right. Thank you. Now, Madam Richlava Mamu, you have the final words.
Okay, thank you very much. So I think we are also working things out with WASH projects so that at least the schools can be gender friendly, where when they put up washrooms, when they are putting up classroom blocks for the children, they can also add gender friendly washrooms where girls can also have the opportunity to change themselves. Even at our workplaces, we request they do that as well. And the other thing I want to tell the NGOs, especially the reps sitting in your office, to try as much as possible and collaborate with the departments of gender in the region. They'll work with RCC through the Department of Gender. The auntie at Plan Ghana is my very good friend seated there. And I think we have been working together, but this time we want them to strengthen collaboration with us so that we can all be able to control the situation. We also urge them to engage the parents as well. In as much as we are pushing for policies, I do not want to speak on policies because we at the regional level do not formulate policies. Okay. It is done at the national level. That is why I'm trying as much as possible not to talk in that direction. That is why my direction, my submission is directed to implementing of projects and programs. And that is what we are doing for now. But we are working things out with the WASH projects here. We are working together with the environmental director in the region, and I'm on his committee as well. So we are pushing that agenda for school, gender school friendly, so that the school plays, maybe when they go to school, they can be comfortable to go in there, change themselves, and be happy in school to continue their education. We know a lot of them are dropping out because of these issues. So
Thank you so much, Madam Richlava Mamu, the Central Regional Director for Gender. I was also joined by Anna Nabre here in the studio, who is a project manager for She Leads under Plan International Ghana, and Holali Delechu, the alumni president and convener for the petition that was sent to government in 2022 to remove taxes on 2020 to remove taxes on sanitary pads. And of course, the former Minister for Gender and Children and Social Protection and the Executive Director and founder of Henry Jaba Memorial Foundation, Dr. Otiko Afisa Jaba, also joined the conversation. Thank you so much, ladies and gentlemen, for getting into this all-important topic. And on that note...